Workers, issues with immunization, usually gender mainstreaming, gender stereotyping, issues around men usually are not involved in immunization activities. You hardly see a man stepping in for the woman when the child's time is up for a certain vaccine. Usually they don't even know when the child is due or not, what the child has taken and what. I even had a personal experience. My son was sick as well. I work in a hospital. My husband is a biomedical scientist. And I left my child just to go home and get a few stuff and come. My husband was there with the child. So the doctors came around and was like, has he had his 1.5 is due for this vaccine? Has he had it? My husband had no idea. He is a healthcare worker. He's a biomedical scientist. I am a healthcare worker, both of us in the same space, but he had no idea. And the doctors had to take a phone and call me. Has your son had this vaccination? I didn't see that in his book. Then I was able to explain to them that because he was sick, he could not have taken the vaccine until he's well, because if a child is febrile, we don't give vaccination. But that's what pertains in our society. So even if irrespective of your social status, irrespective of what you do, it's actually a challenge. They've tagged immunization, such roles to women. So even if the person works in the hospital, there's still a challenge. If the person is not there, the child misses a dose. Generally, I would say nurses face a lot of challenges because comparing ourselves to other countries, we have a lot of challenges. So right from school, you come down and sometimes the things you have learned from school, they've used simulated, they use a lot of simulations, so you don't see them in reality. So you come to the hospital and then you have to improvise for almost everything because they are not there. You have to improvise for almost everything because the things you have learned how to use are really not there for you to work with.
You mean supplies and equipment, things like that?
Yes. You don't have the adequate supplies of the equipment for you to work with. And then salaries are too low. Actually, you can barely survive if you have more than 3 children and they are going to good schools and you are a nurse, you can barely survive unless you have a support from a husband or you have something else doing, or you have to do 3 or 4 jobs before you can survive. Looking at that, the place of accommodation, I have to stay in traffic for about 3 hours in, 3 hours out sometimes to go to work. So you can imagine that 6 hours could have paid me something if I'm to do another thing, but you can't. Because where you live, you still have to go to work and you stay in traffic. So coupled with urbanization issues affect you. So you get to work stressed and you still have to attend to people who are waiting for you. Organizations have that equal opportunities because, our culture started where most priorities, most privileges were given to male children. So you grew up with it. So even in the workplace, they will give higher salary to a male, even though you have the same qualifications. The opportunity will be given to a male, even though you have similar qualifications. So our culture started like that. So you still have those traces in some organizations. So it's not a uniform thing that you have people having equal access to services, to promotions, it still exists. Yeah. For instance, in our hospital, you have females who also have a master's in public health. But when it comes to, let's say, giving a position to someone with master's in public health, they'll go for a doctor who is a male and leave the female behind so that that male doctor can man the hospital. So it's there as well, but it's not a uniform. You see some places trying to pick up though, but it's actually exists. Yeah.
Is it with the government services? Is it the same that you're?
Yeah, the government services, it depends. because mostly they still consider the male. So you see a lot of males heading a lot of organizations, government institutions. Most of them are male. Hardly will you see females heading those institutions. In my hospital, ever since I came there hasn't been any female chief executive. It's all been males throughout. I think female health workers first thing to consider is the female health worker herself. Is the salary you are paying the person enough to take care of her upkeep? What the person can eat, where to sleep, how to commute to work and back? Is it okay to take care of that? Secondly, the tools that the person needs to work with. Why should the person suffer to get gloves to work with? Why should the person suffer to, even put up an innovation that will serve a whole national asset and then no one seems to support? Why should the person go around seeking for support that everyone at the end will benefit? It is not right. I think you look at that, the tools that the person will work with, and when the person is working, if you are the head, visit the person, see, are there challenges that where we can make it better? 10 years to come, will that project still stand? How can we make it better that other generations will also come and benefit? I think these are the things that we need to put in place so that at least we can create sustainable, healthy workplaces and then let females also go where they are working. Yeah. I think you get choked. And so they either stop working in the health sector and move elsewhere, or if they find chance on a better opportunity, and then they leave. So not until then, some try to remain, some don't even bother themselves at all, because at a point they will fight and fight, it doesn't get anywhere. But for some of us, even when we are not paid just for the fact that somebody's life will be better, we'll keep on doing it. We'll keep on going. Yes, we'll keep on moving. Yeah. Even we do that outside our work facility. On my way home, I remember during COVID, I can stand in the public bus and give education. I can stand in the public bus and distribute masks where no one has given to me. I give it free of charge. And so we could do more, because we know that if one life is better, a lot more people's life will be saved. So then the later, and if you live it as a health worker, if you live it, one day it will come to you. So seeing someone suffering from, let's say, any infectious disease, and you can assist the person and you live it, you may not know that person's child might be in the school where your child is. So then it gets to you, and then your child will have it and you will have it as well. So then why don't you save lives and make the world a better place for everyone?
So I just want to sincerely thank Ruth. I mean, she's amazing. She's online. I see some of the comments, but really a pleasure to speak with her. Jean, back over to you.
Thanks, Alyssa, and I'll second that. Thank you so much, Ruth, for sharing your insight and what it really is like to be a health worker in the communities where we're trying to reach.